Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty.
Right, Chris, tell me what's going on with your wrist. What happened?
I guess I kind of aggravated an old injury driving to work. And I guess I made it worse. Just continuing to work on it.
How long has this been going on?
For a few days now.
Okay.
It was really bad a few days ago. It's gotten slightly better.
How much pain do you feel there from 0 to 10? 10 is emergency room.
It was a 10 at some point.
Okay.
And
so
now it's like at a 6, 7.
6, 7.
Yeah.
Where do you feel the pain? Would you show me?
In my wrist, right here.
Okay.
Right here on the inside and outside of my wrist.
What would you show me your range of motion? What's difficult for you to do?
So I'm getting a little bit of tightness trying to grip and also extend my wrist back as well as go forward.
So it's looked like it's very tight here.
Yeah. So this is pretty much as far as I can go.
You're not really flexing much. Yeah. So how many days that was?
So it got really bad Wednesday, Thursday.
Wednesday, we are on Monday now, so it's almost like 5 days or something like that,
so
4 or 5.
It's pretty tight ever since.
Have you had any treatment before coming here?
Just a small consultation with the chiropractor.
Okay.
Other than that,
did he do anything?
He's used the metal knife to break down some
Graston, yeah.
But other than that, he just gave me a few home exercises. Other than that, no other treatments.
Okay, so everything we do should not aggravate your symptoms. I'm gonna take your range of motion, and then we'll do the treatment, and then we'll take it again. Okay. So how much pain you feel right now?
If I rest it like this, it's okay. Thursday and Friday, I was in agonizing pain, but I didn't want to go to the doctor.
So if we aggravate your symptoms now, how much is it gonna be? Just do the range of motion that aggravated, and because we're gonna use that for testing now after the treatment. So extend and flex and tell me how much pain.
Right. I mean, it's tolerable right now. Keeping it that way, it's
Just flexing this way,
testing purposes, I can manage it.
Bring it this way, and flex and extend. Yeah, you're very tight, very slow, actually very stiff, and you can see a little bit swelling here. Your range of motion is very limited. We're gonna work on that. Okay, how much pain with that?
Maybe like a 6 or 7.
Okay, so relax. Okay, so I want you to remember this range of motion, okay? So for extension, let's bring it back up and stop when you feel pain.
Okay, it's tight there.
It's tight. Yeah. So you can see like it's a 50. Well, 1 second. Here you go. It's a 55 here. This is 55. Extension 55. Remember these numbers, okay? Flexion.
Alright, okay.
How much pain with that?
That's okay right there.
That's a 35. 35. Okay. Second. So 55, 35. We'll do ulnar and radial. No, you don't get that. Okay. So radial range of motion, bring it in this way. Sorry. How much? No, okay. How much pain with that? This is like 6. Okay. The other way. Okay, that's like 20. Okay, 6, 20. Okay, supination, pronation. We need to get the range of motion. This is not the best goniometer. We don't have the small one, so this one this is pronation 80. It's like 80, 83. Okay, turn it the other way. That's not bad.
So it's not a big deal. It's like 9, so it's not a big deal. Okay, so you can rest. So your range of motion is very limited for extension. It's a 35. Flexion is 55. Normal should be like 80 to 90s. Okay. Radial and nominal deviation, that's your radial deviation, 6 degrees, should be like around 20, 25 or 30. And ulnar is 20, should be around like 30 or something like that. So make sure what I'm doing is not aggravated. Okay. So you had these bruises from the Graston? Like
Yeah,
when you worked
yeah.
on it? Okay. And when that was?
Saturday.
Oh man, so it's like it lasts for 2 days.
Yeah.
That actually causes inflammation, and that's what I disagree with. When you have inflammation here, that's mean your body gonna build a new scar tissue. So
Yeah.
there is no guarantee the new scar tissue gonna be less than all the scar tissue.
Yeah. That's
And
what I learned.
and you know, so scar tissue, the muscle should act like a rubber band when it contracts and relaxes. Does this? When you have a scar tissue in the muscle cannot contract much, and that's actually could decrease more range of motion. It's unfortunately it's bad philosophy for treatment that it's gambling of the outcome of the release. Make sure this is not painful, okay?
No, it's fine.
So what you do for a living?
I work in inspection.
Mm-hmm.
Yeah, and I'm usually at construction sites. So,
Mhm. So you're driving a lot?
yeah.
Is that how it started, from driving?
Yeah.
Uh-huh.
I'm always, my wrist is always in a certain position from driving to certain job
Uh-huh.
sites, a couple hours a day. So
Uh-huh.
I didn't realize, at the same time I would aggravate it, just having it in a constant position.
So you were just holding like this, the
Yeah.
steering wheel?
Yeah, exactly.
Uh-huh. You feel the tightness here?
No, but it's
Yeah.
fine. Yeah, Friday, if you were to do this, I'd totally be against it.
Yeah, it was very like tender to touch.
Yeah.
Yeah, it's not bad, but you still have swelling. Let me see the other one. We can see the swelling here in this area. You see the difference?
Definitely,
Yeah, that's this is normal. This is like swells more, so it's probably from you strain it from like repetitive like holding.
Yeah, that's exactly the
that's-
position that I.
That's called repetitive strain injury. Before the video, I did test for carpal tunnel. It was fine. So just to make sure he does not have carpal tunnel syndrome. So your pain is just like a band around
Yeah.
your wrist. Turn it over. Did you work in this area? When you
The
did
chiropractor?
Yeah. You have a
yeah,
lot of scar tissue here.
he just went the bottom right here. I don't remember.
She did not work on
I
that
don't think
area.
so. Yeah, from what I remember.
I'm glad she did not do a lot of work, because that's a lot of bruises here for three
Yeah.
days. That's not good. Let me know if it's too much, okay?
It's tolerable. Yeah.
Yeah, make sure this is not aggravating your symptom. You feel this knot here?
Oh, yeah.
You feel that? And you can see it in my hand. You see it's my hand is just. You see? Sorry, is that
No, no,
painful?
it's alright.
Okay. You see that? That's a big knot inside here. So with this instrument, Graston, you will never be able to get to this.
It's very deep inside. That's not gonna get there. Is it too much?
Earlier it was a little bad, but now it's bearable.
Okay. There you go. Sure, it's not too much, okay?
Okay.
Yeah, I didn't need to mention that. Well, okay. I still have here. I can go deeper. Okay. You see, this is not as bad as here. For that, but all of them here. Let me know if it's too much. Okay. Okay. I'm gonna work on it. Tune into it one. So it's been limited like this even after you had the treatment, the Graston treatment and the chiropractor treatment. Okay. So, alright, you can feel cold, okay? Make sure it's not painful. Let's pull this up. You will see the scar tissue where you have redness here, but make sure it's not painful, okay?
Yeah.
So you said your pain, you have pain here too?
Yeah.
Because I feel a lot of pain in this area. In this area. Sorry, is that too much?
A little bit.
Okay.
It's nothing as bad as Saturday.
Saturday?
With the chiropractor.
Yeah, Graston is more, it's painful, yeah?
Yeah.
Yeah, I don't agree with this philosophy. So think about this pain like a check engine signal on your car, okay? So there's two approaches to address it. One is cover the signal and keep driving and hope for the best. Two is treat it,
Right.
and the check signal will disappear. So that's why I disagree with those approaches, like they cause more pain because they actually causing more damage and you keep driving. So you really don't know what you're damaging from that pain. So it's actually cause more harm than benefit.
Right, I see.
That's why I disagree with, with this philosophy, and I hope healthcare providers to start to think twice before putting patient in pain, because that's actually not helpful. That's actually going to make things worse. We should do no harm, not harming patient.
Right.
That's actually the first thing we learned in the school. Do no harm. Unfortunately, a lot of those instruments and techniques, they just believe in pain and they're causing more damage than benefit to the patient.
Right.
Is that too much here?
No, it's actually more relieving.
Okay, let's actually clean it, and I want you to move up and down and tell me how much pain you feel now. Just move it. How's that? Look at that. Can you tell the difference?
Yeah.
I'm going further. Where do you feel the tightness when you go down?
Probably like from up here.
Okay. Yeah, do more work here. Okay. Still recording? Okay. Let me know if it's too much here. Okay. You feel it right in here, yeah? You see all this redness? That's all scar tissue.
Oh wow.
Yeah, that's a lot of scar tissue. And it's deep, and that's why I use the other instrument to get deep. And if it's too much, okay.
Okay.
Okay, try it again. Extend. Good. Going further. Flex. Any pain with that? The swelling, that's went further actually. Okay.
Yeah. It's
Where do you feel it when you do this?
kind of like right here.
Right here. Okay. Okay, try it again. How's that? And extend. Any pain? Any pain, discomfort? Okay, you're gonna tell me the numbers here, okay? Alright, flexion. Flexion, how much it was?
55.
55. Up. Okay, so flexion here is almost 85. Oh, 75. 75 here. Okay.
That's pretty good.
Down. Extension, how much it was?
It was 35.
I'm sorry, this is extension. That was extension
Okay.
number. Okay, I messed it up. That extension was 55. Now it's 75. What about flexion?
35.
35. And that is, let's see, that is 55.
Wow.
Right here, let's do it this way. Okay, it's 55. Okay. What about radial deviation?
From 20.
Radial
Or
deviation.
6.
Radial deviation was 6 degrees. Let's bring it in. 6 degrees now. 1 second. Here we go. That is 20 degrees. You see that? 20 degrees. That was 6 degrees. Okay, that's good. Ulnar, how much it was? Ulnar was 20. Okay, let's bring it out. Ulnar deviation was 20. Now is 30 degrees. Okay, so move it and tell me, do you feel pain?
It's not as much as before.
0 to 10.
Yeah, it's definitely like 4 or 5.
So it went down. Where do you feel the pain?
Probably.
The end range of motion.
Yeah, probably the tightness from right here, but it's not as bad as when.
Is it pain or tightness? The feeling you feel?
It's probably tightness more than anything else.
It's not painful.
It's not. It's really not painful.
Okay. Where do you feel the tightness now?
Probably just right here.
0 to 10.
Maybe like it's not as bad as before. Maybe under a 5, like a 4.
Okay, you feel it right there? Okay, let me work on that. What did you write? Oh, okay, this is extension, flexion, and 75,
55.
30, and this is what was 20.
I think so, yeah.
Okay. We're gonna work on this, and we'll measure it again, okay? Yeah, you feel that warmness?
Yeah.
That's swelling. That is swelling. So I don't expect you're gonna get 4 range of motion because you have swelling there. But at least if we get you like to 90% of the range of motion, I'll be happy. Because you still have swelling compared to the side. But put your hands here. Can you see the swelling here?
Oh yeah, definitely.
It's a lot of swelling. So that's gonna be in a way for full range of motion. But if you don't have that swelling, it's very easy to get that 4 range. Do you see the difference between both of them? You see the swelling here and the swelling here. No swelling here. It's very full here compared to this area.
Yeah, that's where when I was
You see?
flexing, that's
Yes.
where the tightness was coming from.
So that will not, we'll get the range of motion as far as possible,
Right.
but the swelling gonna be in the way, so you're gonna be missing like 15 or something degrees at the end of range of motion. I'm gonna take the range of motion again after releasing this to see how far we can go. Make sure you tell me.
Yeah,
It's okay. Right. Oh, man, you're very tight here.
Yeah, put in the work done.
Yeah, you make me sweat here. Working hard, okay? Yeah, the instrument actually make it not working hard. I just
Yeah.
it's very easy to use. That saved my hand. So let's move it now and tell me how's the tightness now from 0 to 10. You're moving faster now.
Yeah.
Yeah, you see
yes.
the speed? That's beautiful.
Yeah, before I used to be very gingerly about all my.
Yeah, it was like a gear.
Yeah.
It
It was grinding. It was
Yeah,
grinding.
yeah. It was like
Now it's
sti-
like okay.
it was like a stick shift. How's that? Any tightness?
A little bit, but it's much
Where?
better. Like I was.
How much and where?
But it's smaller. It's like maybe like a 3.
Where?
Like right here.
Okay. Okay.
Seems like every time you fix one spot, the smaller spot keeps
Yeah.
showing up. But
Yeah, well, we're moving on because you start
yeah.
to compare tight to loose, tight to
Exactly.
loose. So that's a good sign. We're moving on. It's not we're stuck in one area.
Exactly.
Yeah.
exactly.
But that shows that you have a lot of mess here.
No, it's probably been years and years of like
Years.
just neglect.
A lot of
Yeah.
driving. Yeah. Yeah. So let me get this thing. Okay. Let's do it again and tell me how's the tightness. Extend. How's that? Flex. How's that? You still feel it? It's gone.
Oh wow. Before
You're
I
making
can.
fists. You could not make a
No,
fist.
no.
You were like sitting
Yeah, I
like
was
this.
just like this, but before
Yeah.
now it's like I can actually apply some pressure.
Yeah, that's cool. Any tightness?
Slight, but it's not something that is unbearable.
It's
And
probably
that's just-
from the swelling
Yeah,
there. As
yeah.
long as you don't
More
feel,
than anything else, it's probably from the swelling.
as
It's
long as
not-
you don't feel pain, that's fine because I
It's just
expect you're
tightness,
gonna
it's not
have a
pain.
little bit tightness from the swelling until we get the swelling down. Okay. Extension. How much was originally?
55.
55. Now is. Look at this. 75. We're maintaining that range of motion. 75. Okay. Flexion. How much it was?
35.
35 originally, and let's see, just lower this down. 35, and now we are 60, almost 60, 63. 63. Okay, ulnar, radial,
Radial 6.
6, and now see how far we can go with this. What's that? That's 20. 22. That's 22. You see that? 22.
Yeah.
Yeah. Okay. Let's do the other side. How much is the radial?
That was,
Oh, the ulnar. This is on
20.
20. Now is 30. 32. Here. So move your hands and tell me how they feel. What do you think about ASTR treatment? Just working
feel
for a
lot
few
better.
minutes.
Yeah.
So can you tell the difference between Graston and ASTR, because you had Graston 2 days ago?
Yeah.
Can you tell any difference?
Oh no, this is much gentler.
Yeah.
Over there, I kind of felt like a slab of meat, but this one's more.
Yeah. So it was painful. Graston was painful, and this is not painful. What about the range of motion?
It's a lot of progress for only. A
Yeah.
few
Did you
months,
get any progress with Graston when they moved worked
when
on
they-
it?
I think a lot of home therapy might have helped, but the Graston is pretty painful.
Uh-huh.
But this is something that I'd much rather prefer than
Yeah.
doing Graston.
That's awesome. Yeah.
Yeah.
Yeah. Thank you so much.
Oh, I appreciate it. No,
Yeah.
thank you.
Any pain, discomfort?
No, just tightness, but not really pain.
Tightness from
No,
the swelling.
before
We
it
can
was-
work on it. Yeah.
Yeah, walking in it was painful.
Look at you. You're moving your hands now. Yeah. Yeah.
Oh no, this is a significant difference.
Yeah. That's beautiful. Look at that. Yeah. Awesome.
Yeah.
Thank you so much.
Thank you. I appreciate it.
Yeah.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.